Health Alert is brought to you by OU Physicians in Tulsa. Hello, welcome to Health Alert. I'm Pam Butler. Today we're going to talk about cervical cancer, and joining me is Dr. Eric Wallace, Associate Professor in Internal Medicine at the University of Oklahoma School of Community Medicine, and also OU Physicians in Tulsa. Welcome.
Well, thank you.
Now, before I begin, I want to tell our viewers they may hear a little bit of background noise because we're having some construction outside the studio. So if they all of a sudden think they're hearing some buzzing, it's not us, it's outside.
Okay.
A few weeks ago, you were here and we did a program looking at breast cancer.
Correct.
Now, I wanted to have you come back so that we could look at cervical cancer.
All right.
Let's start off talking about cervical cancer. What exactly is cervical cancer so people understand where we're talking?
Right, so cervical cancer is much less common than breast cancer.
Okay.
Before we talked about how there's about 150 new cases a year of breast cancer, 40,000 breast cancer deaths a year.
Mm-hmm.
With cervical cancer, there's about 11,000 new cases per year and about 4,000 deaths per year. So significantly fewer number of women have cervical cancer and die from cervical cancer. So it doesn't carry the emotional weight that the breast cancer does, whereas we know a lot of people who have breast cancer. We don't know as many people who have cervical cancer because it's not as common.
Okay.
And one of the reasons for that is the Pap smear. The Pap smear has been the single best cancer screening tool that has ever been developed in terms of reducing the number of deaths from cervical cancer.
Okay.
And so cervical cancer is something that is caused by a virus, and most people wouldn't.
You wouldn't think by a virus because a virus, okay, that implies, we think, that you can catch it.
Absolutely.
Okay, how do we catch it?
So the virus that's known to cause cervical cancer is the human papilloma virus, or HPV virus.
Okay.
And this is a virus that is obtained through sexual contact. So as you engage in sexual intercourse, you are at risk for developing the human papilloma virus infection. And the HPV virus can cause several different things. One is it's a known virus to cause genital warts, but there's certain strains of the HPV virus that can actually increase your risk of developing cervical cancer.
Now, with this, then, does that mean the virus is in the male and it's being transmitted to the female?
Right. It can be transmitted through sexual contact with a male. That is certainly true. So a male can be a carrier, and then through sexual intercourse can transmit that to a female.
Okay, so if we look at this in terms of the human papillomavirus, and we'll get into some other things, correct me now if I'm wrong, I'm misinterpreting because others may be as well. If the male is sort of the primary source of the virus, or can women have this virus in and of itself and catch it by sanitary products, using tampons or things such as that?
Generally, no. I mean, this is known to be a sexually transmitted infection, so it's going to be obtained from your partner.
Okay, now, does that imply, because we're going to talk about cervical cancer and screenings and that for women, but what does that mean for men? I mean, are there tests that they should be engaging in to see whether or not they're carrying this virus? And how do they get the virus?
Well, not necessarily test at this point. Men typically don't show any signs or symptoms of the human papilloma virus unless it leads to the development of genital warts. But again, there's other strains that a male can carry that, the man wouldn't know anything about it. He wouldn't have any symptoms, but can unknowingly transmit that to a female. And the virus is very common.
Okay.
It's not something that's a rare infection like HIV, even though HIV is something that's very much on our minds, and we feel like is very common. It's much less common than transmitting the human papilloma virus.
Okay, so at this point there's no tests for males to undergo to see whether or not they have this virus, so there's no way to know ahead of time. And is the virus in the male sort of acquired from a female who's been infected and the male gets it, or does he get it from food, air, or I mean, how does he get it?
I would make the assumption as a female that if you're engaging in sexual intercourse that you are exposing yourself to the human papilloma virus. That's probably the simplest way to look at it.
So it becomes a cycle almost.
Right, and for most women it won't cause any problems, but for a certain number of women it can lead to a very serious problem, that is cervical cancer.
Okay, now when we think then about cervical cancer and this human papilloma virus, I mean, how young, you talked about 11,000 women will be affected per year in general in the country, and about 4,000 die in general. How young do you tend to see cervical cancer? Do you tend to see it prepubescence, you know, before the menstrual cycle starts? Do you tend to see it more in the 40s, the 30s? I mean, tell us about when do you tend to see this occurring?
Right, so, and this is part of the reason for the newest set of recommendations that came out on cervical cancer screening. Whereas with breast cancer screening, there was tons of press, tons of debate and discussion around it. Literally a week after those guidelines came out in November, the American College of Obstetrics and Gynecology issued a new set of guidelines on pap smears in cervical cancer screening. And there's been virtually no public discussion about it.
No.
And a lot of people aren't aware that there's new guidelines out. But the guidelines, the change in the guidelines is very similar to what happened with breast cancer. They determined that cervical cancer is very uncommon in young women, especially teens, adolescents, young adults. So it used to be that we started pap smear screening earlier, either age 18 or perhaps 3 years after the initiation of sexual intercourse. So that could have been someone in their early to mid-teens that you might do pap smears. But cervical cancer in that 15 to 19-year age range is extremely small. It's about 1 or 2 patients out of 1 million who will develop cervical cancer. But the risk factors for cervical cancer are, number 1, the human papillomavirus, which you expose yourself to when you have sexual intercourse. And number 2 is the duration of the infection. So the longer you have this infection, the more likely you are to have cells in your cervix start to transform into first precancerous cells and then later on into cervical cancer cells.
Now, is the cervical cancer, in terms then of this development, like say the longer you have it, the more it's going to be able to change and get from precancerous to the different stages of cancer? Is it a slow growing type of cancer, or is it one that's relatively quick? Because and answering that in relation to, is the recommendation still to have your pap smear once a year?
And the recommendation now is to not have it once a year unless you are...
Doctor!
I know, unless you're there are certain exceptions to that. But for most women out there, because it grows at a certain rate and because of how sensitive that test is, they actually recommend spacing that out to more or beyond once a year. So specifically for women aged 21 to 29, and they recommend not doing pap smears until the age of 21, regardless of your sexual history, because the rate of cervical cancer is so low before the age of 21. And because as a healthy woman who has a healthy immune system, when you get that virus, and even if it starts to change the cells in your cervix, they found out that most young women have a healthy immune system that will attack that virus and reverse those initial changes that were then leading to what we thought would be cervical cancer. So a lot of women were undergoing additional pap smears, additional testing, additional procedures where they really didn't need to undergo that because they were likely to essentially cure those precancerous cells at an early age. So number 1, don't start pap smears until age 21. From 21 to 29, you should do a pap smear every 2 years instead of every 1 year. And then starting at age 30, you can start having pap smears every 3 years if your previous 3 pap smears were normal.
I'm going to stop you on that one, doctor, and we're going to come right back and pick that up, take a really quick break. We're going to come back to this age 30, and because this is a change.
Yes, it is.
Please stay with us. We'll be right back.